Okay. There are lots and lots of information resources on this program. As I said, we couldn't possibly get into all the details tonight, but I just want you to know that there is a plethora of information on the CMS website. There is a home page for the EHR incentive programs. There are all sorts of separate pages. One, that you can get to from there. The one on meaningful use has all those specification sheets that will be very helpful to you. When you go to the registration and attestation page, it actually links you to the online module to carry out that process. But it also provides you the user guide, videos. There's a link on that page to this EHR Information Center, and they are the go-to folks if you're having any problem with the online registration or attestation process. They can help you. You can link and send them an email, or you can call them. And then another resource is, that's our regional divisions, regional email box. If you can't find what you need, or you have a general question, or you're just confused about something that you saw on the website, you can send an email to our office and get it in that way. Likewise, you can certainly call the EHR Information Center too. And then in addition to that, CMS is getting all involved in the social media, if that's your way of getting information. They're tweeting. They're tweeting using Twitter. I always get those confused. They're tweeting. They're doing YouTube videos. They're on Facebook. So, we're trying to get hip to all this electronic stuff too. So if that's your method of getting information, go for it. I personally have not looked at our Facebook stuff, so I can't really vouch for it. Also, I want to mention the regional extension centers, and Paul did mention them recently, just briefly, but I can't say enough about these folks. There's a regional extension center in every state, and their sole purpose is to assist eligible professionals and hospitals in assessing their needs and getting up and going on adopting EHR technology, achieving meaningful use, taking advantage of the incentive program. I believe we have individuals here tonight from both the Missouri, the KFMC. Is anybody? Thank you. So, and from Missouri, the Missouri. Oh, okay. So feel free to talk to these folks. I think they may have brought some literature. They can tell you more about their services, but they are an excellent resource and partner, and find out what they're all about, because they can be helpful to you if you're pursuing this path. This is the webinar I was mentioning. This is coming up May 4th, and we'll be doing similar presentation to what's been going on these national calls. So please join us if you can, and get a little information on that. Okay, I know that was fast, but I have a couple more things I wanted to talk about. We want to say a little bit about something else that should certainly be on your radar screen, and that is the conversion to the version 5010 standards for electronic transactions, as well as the conversion to the ICD-10 coding. We want to make sure that everybody is aware and complying with these changes, whether you bill directly or through a clearinghouse or through a billing service. You should be at the point of doing external testing of your version 5010. In fact, you can begin submitting claims using version 5010. But by the end of this year, we will no longer be accepting the 4010 version. So claims using that 4010 format will not be accepted after January 1st. And then, of course, lastly, the transition to from ICD-9 to ICD-10 for diagnostic coding and for procedure coding for inpatient services is coming along October of 2013. Likewise, there are lots and lots of resources. These are some of the resources you can turn to for getting information. Also, WPS, Wisconsin Physician Service, the Medicare claims processing contractor, conducts Ask the Contractor conference calls on this topic, and I believe they are having one on May 12th. And you can look at the WPS Medicare website for more information about that, or turn to these other resources. And I know CMS has been having a series of national calls too. So if you go to our web page, the ICD-10 page there, You can link to more information on that, as well as presentations and other helpful information. Okay, lastly, we wanted to mention a new initiative authorized by the Affordable Care Act that we're working on, and that is the Medicare Shared Savings Program for Accountable Care Organizations. And essentially, this program is aimed at facilitating coordination and cooperation among providers to improve the quality of care for Medicare fee-for-service beneficiaries and reduce unnecessary costs by improving that coordination and the quality of services rendered. This program will reward participating accountable care organizations, or ACOs, for being accountable for the quality of health care provided to at least a group of at least 5,000 Medicare beneficiaries. So if the accountable care organization meets or exceeds certain quality performance standards and succeeds in lowering the growth of healthcare costs for the patient population, then the ACO has the opportunity to share in the Medicare savings that result from that effort. So there was a notice of proposed rulemaking recently issued. It contains lots of details on all of this, on all the proposed policies, on who can be an ACO, how we will assign beneficiaries, what all these performance measures are. The whole ball of wax is in the notice of proposed rulemaking. The NPRM tells you what your options are for submitting comments, and I know I don't have the CMS shared savings program on the version of slides you have. I think I added that after I sent that out to Paul. So, like so many other things, there is a dedicated page on the CMS website for the shared savings program. There's a link to the notice of proposed rulemaking on that page. And when you go to the notice of proposed rulemaking, you know, it tells you all about submitting comments. And I'm sure many of you have submitted comments on proposed rules before. But if you go to regulations.gov, that's an opportunity to submit your comments online. So pretty streamlined way of doing that. So if you have an interest in the Medicare Shared Savings Program or ideas about how this should be dealt with and who should be able to be an ACO and all of that stuff, we certainly encourage you to look at the notice of proposed rulemaking and submit your comments by June 6th. And of course, as the year wears on, you'll be hearing a lot more about this program from CMS. As I said, or as the slide shows you, this is a program that needs to be established by law by January 1st of 2012. So it is kind of tight. There's a lot to be done this year, but all signs are that we are going full speed ahead, and we'll be implementing this January 1st. So we have run through an awful lot of material in a short period of time, and I probably talked 3 times faster than I should have, and I apologize for that. But I hope it was helpful information, and we wanted to allow plenty of time for your questions. So let me turn over the floor to you all and just see what's on your minds.